My name's Ian and I'm a public health consultant at Redbridge Council. You'll already know there are some variants or slightly different versions of COVID-19 around the world. Viruses often change and this isn't unusual. Public Health England has told us they've found isolated, non-travel related cases of what's known as the South African variant of COVID in our borough. The weekly number of COVID-19 cases is falling in the borough, but it's very important to work out, as part of the government's response to the pandemic, whether the South African variant has spread further in our communities. To do that, we'll be offering mass testing to everyone aged over the age of 11 in the areas where the variant was found, and that's starting from today, Friday the 30th of April. If you do live in one of the identified areas, you'll receive a letter in the post from Redbridge Council over the bank holiday weekend. It'll explain how to get tested and what support is available. Our COVID community testing team will be offering door-to-door PCR tests between 9:30am and 5pm each day. The team will be wearing PPE and will have identification showing that they're working for our council. If you don't have symptoms and live in one of the affected areas, you can also get tested by visiting a testing site. These are open 7 days a week. There's one at Canaston Square in Barkingside, and that's open between 9am and 3pm. And then there's further testing sites at Mildmay Road in Ilford, that's 8am to 8pm, and at Gants Hill Library Car Park, also 8am to 8pm. 1 in 3 people who have COVID don't know that they've got it, so you don't need to have symptoms to take the test. There'll be clear instructions in the kit on how to take your swabs and register with the Department of Health and Social Care. You'll then be able to hand the kit to a volunteer who'll wait to pick it up from you. There's no evidence that this variant, or any of the other variants, cause more severe illness or that the approved vaccines won't work. You don't need to change anything in your daily lives because of this testing, but the government's coronavirus lockdown restrictions remain in place, and you should continue to follow the guidelines, including social distancing and hand hygiene. Remember, hands, face, space and fresh air. If you're eligible, you should get vaccinated when you're invited to do so by the NHS. And if you do test positive for any variant of COVID-19, or you've been in close contact with someone who has the virus, you must still self-isolate. There's lots of support available from the council and within communities if you need to self-isolate, and you may also be able to claim a £500 self-isolation support payment from the government. More information on both of these is on our website. This surge testing is a precautionary measure. If there are other cases, we need to find them, and the more we find, the better chance we have at stopping it from spreading further. It's important to remember that as we move out of lockdown, anyone who does not have symptoms can now get a regular rapid LFD test. People who cannot work from home, school children, students, and those who live with anyone attending school or college, or working in such a setting, should take a rapid test twice a week and take the necessary action if they test positive. This applies even if you take part in surge testing. By playing your part and taking the test, you'll be helping to keep your community and loved ones safe. For more information, please visit the surge testing webpage on our Coronavirus Information Hub at www.redbridge.gov.uk. Thank you very much.